My name is Elisa Dowdy. This is my head to toe assessment for spring 2025. Today is January 23rd, 2025. This is the room. This is the ceiling. This is the floor. Okay. I have identified my patient with 2 identifiers. I've washed my hands. We're going to start the assessment by looking at the skin of the head, neck, face, anterior, posterior, chest, abdomen, upper and lower extremities. We're looking for color, temperature, texture, turgor, bruising, lesions, moisture, edema, scars, and nevi. We're going to move to the head and face. Normocephalic, everything is symmetric, it's midline. We're looking at the hair, we're looking at distribution, which is even, color is black, texture, we're looking for any masses or tenderness, any lesions, depressions, or infestations, anything hurting. Okay, all right, we're gonna move on to, I'm gonna palpate the temporal membranes and sinuses, any tenderness there. Okay, all right, we're gonna palpate the lymph nodes, preauricular, postauricular, occipital, tonsillar, submental, submandibular, anterior cervical, posterior cervical, supraclavicular. Okay, now we're going to move on to palpate for TMJ, open and close your mouth. All right, no crepitus, no tenderness there. We're going to test cranial nerve number 5, which is trigeminal. I want you to clench. Okay, perfect. Now we're gonna test sensory with light touch. I want you to close your eyes and tell me where I'm touching.
Chin, forehead, chin, cheek.
Let's try again.
Forehead, chin, cheek, nose.
Okay, all right, perfect. This is my supply table right here. Okay. All right, now we're gonna test cranial nerve number 7, which is our facial. I'm looking for symmetry. I want you to smile, frown, puff your cheeks, raise your eyebrows. Okay, everything looks good. Now we're gonna move on to the ear. I'm expecting the outer pinna and tragus. I'm looking for any kind of masses or tenderness, none noted. Ears are in normal position and normal size. I'm gonna inspect the auditory canal with my otoscope, which is pink, no bulging, tympanic membrane, pearly gray, and light reflex. Same on this side. Pink, no bulging, tympanic membrane is pearly gray and light reflex. Okay, we're gonna test cranial nerve number 8, which is vestibular cochlear, which is the hearing. I want you to cover your right ear and tell me what I'm saying.
1, 2, 3.
Cover your left ear and tell me what you're saying. Tell me what I'm saying.
ABC.
All right, I'm going to use my tuning fork to test lateralization. Tell me if you hear it in both or one.
Both.
Okay, now I'm using the Rene test. I'm testing air and bone conduction. Tell me when it stops.
Stop.
Can you hear it?
Yes.
Okay, I'm going to do the same thing on this side.
Stop. Yes.
Okay, perfect. All right. Now we're going to move on to the nose. It is midline and symmetric. It is in the center. We're going to test cranial nerve number 1, which is olfactory. Close your eyes. Tell me what you smell.
Perfume.
Okay, and then one more.
Vicks.
All right, I'm going to test patency. I want you to occlude your right nostril and breathe in your left. Now occlude your left nostril and breathe into your right. Okay, perfect. You can breathe.
Yes.
All right, now we're going to move to the eye. I'm inspecting the lashes, the brows, the palpebral fissures. I'm looking for color, which is brown. The sclera is white. The conjunctiva is pink. There's no discharge and no lesions. I'm going to use my ophthalmoscope. No, I'm going to check visual acuity, which is cranial nerve number 2, which is the optic nerve. I want you to cover your right eye. Read the lowest line you can.
LFTPH.
Okay, and then your left eye.
LTFPH.
Okay, perfect. 20/20. Now we're going to check your peripheral vision. Tell me when you can start to see mountains.
Stop.
Okay, perfect. Moving on to cranial nerve number 3, which is ocular motor, direct and consensual pupil response. I'm going to turn my light up. Okay. All right. Both pupils respond to light. Red light reflects. Now we're going to test accommodation and convergence, cranial nerve number 3, with the 6 points of gaze. I want you to follow my finger. Okay, now we're going to test cranial nerve 4 and 6, trochlear and abducens. I want you to look at the wall, look at my finger, and follow it. Perfect. Now we're moving on to the mouth. I'm inspecting the teeth, gums, palate, buccal mucosa, trachea, tonsils, posterior pharynx. Open your mouth and say, ah.
Ah.
Okay, soft palate, uvular rise with phonation to lift your tongue up and down. Okay, that is, let's see, cranial nerve number 9, glossopharyngeal, and cranial nerve number 10, which is the vagus nerve. Cranial nerve number 12, which is a hypoglossal, tongue is midline and no fasciculations were noted. Now we're moving on to the neck. I'm going to palpate the trachea. We're looking, is midline. Swallow, I'm testing the thyroid. All right, I want you to look left and breathe and hold it. No bruise. Let me see. You want to do that one more time? Look left. Hold your breath. No bruise. Look right. No bruise. Okay. We're going to test the range of motion of the cervical spine. Flexion, look down. Look forward. Extension, up. Hyperextension, left and right. Lateral, and then rotate. All right. Perfect. Cranial nerve number 11 is hypoglossal. I want you to shrug your shoulders. Perfect. That's intact. Now we're going to move on to the posterior chest. Turn around. We're looking for any kind of signs and symptoms of respiratory. Let me get over here, back in the camera. We're looking for signs and symptoms of respiratory depression. Any use of accessory muscles, tripoding, flaring, nasal flaring, retractions, tachypnea, or cyanosis none are noted. I want you to breathe. I'm checking for symmetry during chest expansion. Perfect. Let's turn it this way. Breathe in. Okay. Now we're testing tactile fremitus. I want you to say 99 when I touch you.
99, 99, 99.
Okay, now I'm going to auscultate all 10 fields and lateral lobes. Just breathe normally. Okay, now I'm going to test egophony. I want you to say 99.
99, 99, 99, 99, 99.
Okay, now I want you to whisper 1, 2, 3. Whisper. Whisper. Okay. All right, while I'm here, I'm going to go ahead and percuss for any kind of CDA tenderness. Tell me if this hurts. Okay. All right, turn around. We're going to move to the anterior chest. Same thing. I'm looking for any kind of obvious deformities or signs and symptoms of respiratory distress. I want you to breathe. Okay, everything rises and falls symmetrically while breathing. I'm going to palpate chest expansion. For tactile fremitus, I want you to say 99 again, okay?
99, 99, 99, 99.
Okay, now I'm going to auscultate. Just breathe. Okay, now I'm going to auscultate my heart with the bell. I'm auscultating the aortic, which is second intercostal space, right sternal border. Pulmonic, second intercostal space, left sternal border. Herbs, third intercostal space, left sternal border, tricuspid, fourth intercostal space, left sternal border, and mitral, which is fifth intercostal space, left sternal border. After that, I am listening, auscultating to the PMI. I'm going to listen for 1 minute. Heartbeat is regular and 65. Okay, now lay down for me. Head is at 30 to 45 degrees. I gotta stay in the camera. I'm looking for JVD. There's no signs of JVD. Everything is midline. There's no shift. I'm palpating. I'm looking for heaves and thrifts, and I am palpating aortic, herbs, pulmonic, tricuspid, mitral. No thrills. Now I'm going to auscultate with the diaphragm and the bill. Aortic, pulmonary, herbs, tricuspid, mitral, and I'm going to also listen with the diaphragm and then the bill. Aortic, pulmonic, herbs, tricuspid, mitral. Okay, now I'm going to move on to the abdomen. Everything looks symmetric. Contour is regular, is soft. First, I'm going to listen to the arteries for any kind of bruits. I'm listening the aortic, renal, iliac, femoral. No bruits noted. Now I'm going to palpate all 4 quadrants. I'm going to start with the right lower quadrant, right upper, left upper, left lower. I'm going to auscultate all 4 quadrants. Right lower, right upper, left upper, left lower. Now I'm going to palpate for the liver. Breathe, hold your breath. Okay, I can feel the borders, and now I'm going to palpate for the spleen in the left upper. Breathe, hold your breath. I did not feel the spleen. Okay, come on, sit up one more time. All right, I moved to musculoskeletal. I'm inspecting first upper extremities, joints of the fingers, wrists, elbows, and shoulders. I'm looking for redness, tenderness, swelling, deformities, nodules, crepitus, and symmetry. Everything looks good. Okay, I'm checking cat refill, less than 3 seconds, less than 3 seconds. Let's do range of motion of the fingers. So flexion, extension, hyperextension, abduction, adduction, thumb opposition. Can you touch it? Okay, perfect. Now let's do the wrist. Let's do flexion, extension, hyperextension, ulnar deviation, radial deviation, rotation. Let's do the elbow. Let's do so flexion, extension, hyperextension. Good. And then the shoulders. Let's go up, flexion, down, extension, back, hyperextension, internal rotation on your head, external rotation behind your back. Perfect. Now I'm going to test the strength of your grip. 5 out of 5. I'm going to test the strength of your wrist. Push up, push down. All right, now your elbows, push up, push down, and then your shoulders, push out, and then push in. All right, everything is 5 out of 5. Cranial nerve number 11 is the accessory muscle. I want you to push against mine. Okay, perfect. Now we're assessing cerebellar coordination with finger opposition. Touch your fingers and your thumb. Okay, and then flip-flop, hand flip-flop, and then finger to nose. So touch my finger, touch your nose, touch my finger, touch your nose. Okay, perfect. We're going to assess stereognosis. I want you to close your eyes and tell me what I put in your hand.
Q-tip.
Okay.
Quarter.
All right, now we're going to test Graphis to EJ. Tell me what I write in your hand.
3. T.
Okay, perfect. I'm assessing the skin of the upper and the lower extremities. I'm looking for edema. Temperature is warm. Color is brown. There's no swelling. Okay, we're going to test DTRs. We're going to start with brachialis. Let me see your wrist. Other one. Okay, all right. Then we're gonna test biceps. Back here. Pick your arms back up. Let's see. Like this. Let's see. Okay. All right. And patellar, Achilles, and then Babisky. Okay, good. Now we're inspecting toes, ankles, knees, and hips. Same for redness, swelling, deformity, crepitus, nodules, tenderness, and symmetry. Everything looks good. We're going to assess cat refill of your toes. Less than 3 seconds. Less than 3 seconds. I'm going to test dorsalis pedis pulses. Present. Present. Posterior tibial. Present. Present. Okay. Range of motion of your toes. We do the same thing we do with your fingers. Flexion down. Extension back up. Hyperextension up. Abduction is spread them out. Adduction is bring them close together. Okay, perfect. Now we're going to move on to ankles. Dorsiflexion, which is up. Plantar flexion down. Inversion is in. Exversion is out. And then rotation. Perfect. We're going to test the strength of ankles, knees, and hips the same as we do with our hands. I want you to push up, push down. Okay, push up, push down, push out, and then push in. In, come in. Okay, perfect. Go ahead and stand. We're going to do the range of motion of your hips. We're going to do, let's see, flexion, extension, hyperextension, okay, circumduction. Abduction is out, adduction is in, and then rotate. All right, now we're going to do the same thing on the other side. Flexion, extension, hyperextension. Abduction is out, adduction is in, then internal rotation, external rotation, circumduction. Okay. Range of motion of the knees. So let's see. Flexion, extension, hyperextension, same thing. Flexion, extension, hyperextension. Okay, now we're going to inspect and palpate the spine. I'm looking for normal curvature and alignment. There's no tenderness, bend over, no scoliosis noted. While we're here, we're going to go ahead and look at range of motion of your cervical spine. So flexion, back up, extension, all the way back, hyperextension, right and left, lateral flexion, and the rotation, turn. Okay, now we're testing Romberg. I want you to close your eyes and just stand still. No swinging is noted. I'm going to attest her gait. I want you to walk towards the camera regularly. And when you walk back, I want you to walk heel to toe. Okay, good, perfect. Now I want you to hop on your right foot. And then hop on your left foot. Okay, all right.
Good, I have more balance.